In our schools, there's a silent crisis that's holding back some of our very best educators. And it's not about the curriculum, it's not about resources, it's about stigma. So today, we're opening up the leadership playbook to really dismantle that stigma and build a school culture where well-being is genuinely valued.
Okay, before we really dive in, just a quick and important note. This explainer is for educational purposes. We're here to talk about leadership insights, not to give out professional medical advice. So please, always consult a qualified health professional for any individual concerns you might have.
So why is this conversation so urgent right now, especially in our schools? Well, think about this number. In some urban school districts, a staggering 55% of educators report experiencing burnout. I mean, that's more than half of the people who are shaping our next generation feeling completely and totally overwhelmed.
But here's where stigma really turns that crisis into a silent one. 34% of educators who are struggling with some pretty severe mental health needs, they don't seek help. And why? Because they are terrified of professional retaliation. They're afraid of losing their job or their reputation just for trying to take care of themselves.
So, how do we begin to fix this? Well, here's our game plan. First, we're going to look at the data behind this crisis. Then, we'll dissect the stigma that's creating the barrier in the first place. After that, we'll introduce a really powerful three-part solution, see how it's worked in the real world, and then we'll end with a practical toolkit that you can actually use to lead the change.
All right, first up, let's get a handle on the sheer scale of this challenge. We need to look at the numbers behind this unseen crisis.
Now, these numbers are high for sure, but the real story is when you compare them. Educators are experiencing burnout and depression at rates that are significantly higher than the general workforce. This isn't just about having a demanding job. This is a profession that is carrying a disproportionate mental health burden.
So the need is obviously immense. So what's stopping these dedicated educators from getting the support they need and deserve? Well, it all comes down to one incredibly powerful barrier: stigma.
We often think of stigma as this vague kind of social pressure, right? But in the workplace, it is a concrete wall. It's the very real fear that seeking help for your mental health could negatively impact your career, your evaluations, or even just how you're seen by your colleagues and bosses.
And this is the myth that fuels the entire problem. It's this unspoken rule that to be a professional means you have to be stoic, that you have to hide any sign of struggle. But what does the evidence actually say about that?
Well, the data shows us the exact antidote: leadership modeling. When a principal or a team lead says, "Hey, I'm taking a mental health day to recharge," it sends such a powerful message. It completely reframes the conversation from being about a crisis you have to hide to being about proactive wellness that we should all encourage.
Okay, so we've defined the problem, we've defined the barrier. Now let's get to the playbook. Research points to a really powerful three-part framework for actually reducing stigma.
It really just boils down to these three pillars. First, you've got social contact, which is all about creating real, direct connections with people who have lived experience. Second is structural policy. That means changing the actual rules and systems in place. And third, safe communication, which is all about how we talk about mental health publicly.
Now, this isn't just some theory. Let's actually look at some real-world examples where this exact framework has created some incredible change.
So our first case study takes us to the Detroit Public Schools Community District. It's a large urban system, and they decided to tackle this issue head-on by building a comprehensive mental health system. And just look at these results. By integrating mental health support for both students and staff, they saw a stunning 44% drop in behavioral incidents and a 27% jump in academic performance. I mean, let that sink in for a second. This is the key takeaway. Investing in educator wellness isn't some separate thing from the mission. It directly improves student outcomes.
So how did they do it? Well, a huge piece of the puzzle was their approach to training. They moved beyond just theory-only PowerPoints. Research shows that contact-based training, where people get to hear directly from peers with lived experience, is so much more powerful. It humanizes the whole topic, it shifts power dynamics, and it actually reduces stigma in a way that a lecture just never, ever can.
Now, for that safe communication pillar, we can learn a ton from public figures like the psychologist Dr. Julie Smith. Her model for talking about mental health is just a masterclass for leaders. The focus is always on education, not on oversharing personal trauma. She maintains really clear professional boundaries, and, this part is key, she always links back to official resources. It is the perfect template for how leaders can communicate safely and effectively inside their own organization.
Okay, we've seen the evidence. Now for the final section, we're going to equip you, as a leader, with the practical and the legal tools to actually make this happen. Let's start with that structural policy pillar. As a leader, it's absolutely critical to know that powerful legal protections already exist. Things like the Americans with Disabilities Act and the Family and Medical Leave Act, they aren't just regulations, they are tools that you can use to support your staff.
And what does that support actually look like in the real world? The ADA calls for reasonable accommodations, and this isn't some abstract idea. It can be as practical as providing a quiet workspace for an educator dealing with anxiety, or modifying a break schedule to allow for therapy, or even granting intermittent leave to manage PTSD symptoms. These are actionable legal requirements.
Now, on a bigger systemic level, best practice points to a tiered system. So, Tier 1 provides universal support, like mental health literacy for literally everyone. Tier 2 offers targeted help, like peer support groups for those who might be at risk. And Tier 3 provides intensive, on-site clinical services for those who need them the most. This is how you build a true infrastructure of care. Which brings us to our final myth. And it's one we see all the time, right? Especially during awareness weeks or months. It's the idea that just making people aware of the issue is enough to solve it.
But the evidence is crystal clear. The buzz from an awareness campaign, it just fades. Lasting change doesn't come from posters you put up in the break room. It comes from the hard work of changing policy and creating real human connection, the very pillars of the framework we've been walking through today.
So, we'll end with a question for you. Armed with this playbook, and knowing that it's structural change that truly matters, what is the first systemic change, big or small, that you can champion in your organization?